My name is Dr. Samir Cook. I'm a gastroenterologist. I've been in practice for 28 years. I graduated from University of Texas Medical School in Houston. I did my residency in internal medicine at University of Texas in Galveston. Went back to Houston and did a fellowship in gastroenterology and have been practicing in Somerset for 20 years. I decided to become a doctor because when I was younger, my brother was a doctor, and I saw what he did, and I thought that would be something that I would enjoy doing. And also I enjoy taking care of people and being able to be part of their lives. The reason I decided to become a gastroenterologist is interestingly, when I was a third year of medical school, we rotate through different fields, and I was in the ICU at the time, and we had a patient that came in sick with a bleeding ulcer, and I watched the gastroenterology team come in and fix the problem, and I thought it would be something that I would be interested in doing. And when I became a resident, I rotated through gastroenterology, and I enjoyed the people I worked with, and at that time I decided to become a gastroenterologist. Actually, when I got out of training in the late 90s, I was in Houston, which is a big town, and I was part of a big group, and it was a lot of driving from hospital to hospital, and I was spending all my time driving from place to place, sitting in traffic, and was a little bit frustrated with my job. And I ran into an old friend of mine from training that was here in Somerset, and he said, well, why don't you come to Somerset and see what you think? So me and my wife came here, we saw the town, fell in love with it, and we thought, well, it's a pretty small town, we're used to a bigger city, I think we'll just stay here for a few years. And then next thing you know, we had kids and raised them, and we couldn't be happier here. I couldn't see myself going back to a bigger city. So I think that the big draw was having one hospital and being in a town where people were friendly and appreciated the care you gave them. The fact that we see people for screening procedures, especially colonoscopies, and we were able to find polyps and remove them and decrease or prevent them from developing colon cancer is very rewarding to me. You'll most commonly find us in the endoscopy suite, where we're doing colonoscopies, removing polyps. We're also taking care of people with reflux disease, stomach pain, bleeding ulcers, and things like that. And about a third of our time we're in the office seeing patients with medical conditions and helping diagnose them and treat them. I enjoy seeing the patients in the office, getting to know about them and getting to know them and their family members. And then if I see them out in public, it makes me feel good that I've been a help to them and made them feel better and taking care of some of their problems.